Thanks for watching our daily 4 News Now Coronavirus Report. I'm Robin Nance. As your coronavirus headquarters, we continue covering the news impacting your family nationally as well as here locally. As of this morning, Spokane County is reporting 317 people with confirmed cases of COVID-19 and 19 deaths. Across the border in Kootenai County, there are 56 cases, still no deaths reported. And Washington students will not fail classes this year. That's part of new guidelines from the state superintendent of schools. This morning, the Labor Department released its weekly report on first-time unemployment claims. 4.4 million more Americans made claims last week, bringing the total over the last 5 weeks to around 26 million. That's about the same number of all the jobs created since the Great Recession. 2 pet cats in New York have tested positive for coronavirus, the first pets to be confirmed with the disease. The animals had mild symptoms and likely caught the virus from their owners. There's no evidence that cats can pass the illness to people. 8 lions and tigers at the Bronx Zoo have also caught the virus, likely from an employee there. Hammers laid down and power tools silent across Washington because of the stay-home order. The sudden stop in construction meant layoffs for contractors and delays for homeowners waiting to move into new houses. But now some builders might be able to start back up under new conditions. Spokane County Commissioner Al French said we need to get our housing industry back up and running. And the Spokane Home Builders Association says it's heard of too many people in limbo as a result of this order.
Literally packed up their furniture in a moving truck. They're ready to move, and I can't finish the house. And so that was devastating for some of those families.
This is an email signed by Governor Jay Inslee's senior advisor sent to a homeowner that is giving contractors a green light to start work again. It says if a family were to be left without housing as a result of not finishing a home, then builders can be considered essential. The governor's office tells us it is requiring homeowners to sign an affidavit if they go that route. Well, people are growing frustrated with stay-home orders. In Spokane, a group gathered near Spokane City Hall demanding the governor reopen the state for small businesses. Gubernatorial candidate Tim Eyman and Spokane Valley Representative Matt Shea were there showing their support. However, others clearly don't agree with those demands. A woman from Los Angeles who says she's stuck in Spokane because of COVID-19 was arrested for throwing eggs at protesters in that rally. Spokane police say 52-year-old Cindy Albert was throwing eggs at cars from her 4th floor window on West Main. When officers tracked her down, they say she was still armed with a carton of eggs. Officers cited her for 3 counts of malicious mischief and a count of disorderly conduct. A new poll finds most Americans are in favor with their local government stay-at-home orders. The study by the Associated Press NORC Center for Public Affairs found that 61% of Americans feel the steps taken to prevent infections in their area are needed, and it won't be safe to lift restrictions anytime soon. Only 12% of Americans say measures to fight the outbreak where they live go too far. About twice as many believe the limits don't go far enough. In Spokane, a different approach is underway to protect the homeless, and it's part of a new medical program that's been in the works for months. Spokane's new street medicine team is screening homeless men and women for coronavirus. There was already a high risk of infections spreading at camps and shelters across the city. That risk has increased even more since COVID-19 first arrived in Spokane. Now the street medicine team is setting out to find people who might have the virus, get them tested, either get them to the site at the fairgrounds or get them to shelter in place.
A lot of times with this population, they aren't willing to or aren't interested or just trustful of the healthcare system and don't come to the healthcare system. So even if we have clinical services ready for them with open arms and they have insurance, they aren't necessarily going to utilize it. And so it's really important to be able to provide care where people are.
Their work will extend beyond COVID-19 from all sorts of things, anything from blisters to hepatitis. Students will not be allowed to fail classes this year in Washington. The state school superintendent announced no child will receive an F grade. But this also means no student will get a pass or no credit. Struggling students can get an incomplete, but they do have options to correct that later. Colleges and others who have access to transcripts will see that caveat.
All transcripts will reflect this grading cycle, a coronavirus indicator.
In a number of local districts, including Spokane Public Schools, middle and high school students have 3 choices: take a pass or no credit, which won't impact the GPA. But since a pass or no credit no longer is an option, the district is ironing out some of these details. Students can also take a letter grade, which would count towards GPA, or they can request a waiver. As for students in kindergarten through 8th grade, they will move on to the next grade unless a parent and teacher agree they should repeat it. We remain committed to finding the helpers in our community, and some of those helpers are lending a hand far beyond the inland Northwest. We are introducing you to a local doctor who has spent the last week in New York treating coronavirus patients. Michelle Sines works as an internal medicine doctor for the Army Reserve. She also works at Providence Medical Center in Spokane. But last week, she paused that job so she could help treat COVID patients in New York City.
The hardest thing is seeing how many people are hit hard fast.
Dr. Sines is part of the Urban Augmentation Medical Task Force in Spokane. Doctors and nurses with that task force were sent to different hospitals in New York to help with the pandemic. Dr. Sines isn't sure when she'll be able to come home, but says she is willing to stay as long as needed. Thanks for taking the time to stay informed with 4 News Now, your local coronavirus headquarters. We hope you stay safe, stay healthy, and have a great day.